this every Tuesday morning and just discuss our basic principles and our concepts and how we came to be and answer any questions anybody might have. So, well, just to give you, I mean, Derek, a lot of you guys already know what we do because we've had discussions, but for those of you that this is the first time I've had an opportunity to meet with and tell exactly what we do. For 20 years, I was an ER doctor. I saw everything that was bad about society, everything that was bad about healthcare. It was inefficient, it was cost ineffective. You see people at the worst of their life rather than at the best of their life. You see people that are unhappy, down on their luck, that have chronic disease, that are dying from chronic illnesses. And you basically, it kind of did a number on me. It took me those 20 years to realize just how poorly, from just an overall healthcare perspective, we were doing things in the United States. And after that came to fruition and I eventually sold that company and moved on into what I thought was retirement, I started thinking just in terms of what could I do differently on a go-forward basis and maybe do something that's the exact opposite of ER, which is basically how this came to be. And in my mind, the way that I can summarize what we do is it's the exact opposite of what an experience would be like if you went to the emergency room. This is meant to be everything that would make you feel better or look better or be happier and avoid having to go to the emergency room unless it's into the twilight of your existence and the last days of your life. It's meant to keep people out of these unfortunate chronic disease states or these chronic malaise states or happiness situations and to deliver healthcare in a very efficient, time-effective, cost-effective manner and be something that's more helpful and happy rather than just something that's kind of sad and going to the doctor to get my checkup for my blood pressure medicine. It's really meant to be sort of uplifting and we use the term lifestyle medicine because for me, it's all about making your life better, not just treating you when you're not so good. So everything that we do here is meant to make you look better or feel better and in some other combination, make you happier. And so everything it sounds like it may be kind of disjointed in some ways. Some of the service lines that we're providing sound like they're not. They don't necessarily go together, but I promise you they kind of do. So we built out this virtual care network in a manner so that we can talk to our patients whenever they want to talk, without having them get up, put on their clothes, drive to the hospital, drive to the office, sit in the lobby with 100 people that are sick. They can talk to us whenever they want. They can put their pajamas on, walk into their study, turn on their computer, and then have a conversation that takes 5 minutes. So that being said, just a quick overview of what we're doing. We're really into what we're calling optimal aging, which is in the other people use the term anti-aging, but it's basically how you age more gracefully and how we use a combination of hormones, nutrients, nutrition, fitness, coaching to basically optimize the way that you age rather than just succumbing to the effects of aging. We've intertwined that with aesthetics because I truly believe that beauty starts from the inside out. You can have all the plastics work you want, all the aesthetics work you want. If you don't address the other side, I think people are selling themselves short.
So, and what do you do? So you got these low T centers for men and all that. It's bigger than that because you have more hormones than just T. I could give you testosterone, you'd feel a lot better. However, it's more than that. It's all your hormones, right? And so, again, you mix the hormone replacement, and it's not really replacement like John alluded to. It's restoration. It's putting you back to when you were 30. We don't see anybody below age 40 because I think it's probably unethical. We're not giving growth hormone to kids. We're not doing, we're doing what we feel is ethically responsible, and we're using low doses so there are no side effects, and we replace all your hormones. Used to be, growth hormone was about $1,000 to $1,500 a month. Now it's come down with the new recombinant RNA, and so the price has gone down, and so I think, again, we're at the infancy. It's the closest thing we have to a fountain of youth right now, the way people feel. We got about 20 people in our study now. I can't divulge names, but I can, he and I. And Tammy knows a couple. And universally, everybody is, getting close to running out. And they're feeling better, they're feeling younger, their skin looks better. It really is compelling. I mean, it really is a before and after. And why do hormones work? Because every cell in your body has a receptor for them. It's not like, it's like insulin, or it's one of those things that it's released in one area and it has an effect everywhere. And that's why hormones are so important.
The reason we built this, Sharon, was because, you know, in a year from now, or, you know, God forbid, sooner than that, we're gonna have a whole group of people just like ourselves that are gonna want to do events, celebrate kind of life, and we're gonna be doing a lot of events and parties and things in this space. It's not meant to be exclusionary. Actually, this is a place for we're calling them patients, because people are gonna be our patients, but they're basically our partners in lifestyle, and we're basically going to celebrate and do things together and employ some of our other lifestyle extension partners in the fitness and the restaurant industry and other things, and we're going to do fun things together, and that's why we call it a club. It's not, there's no cost to be in this space right here. This is meant to just be a place to kind of enjoy fun times.